When it comes to dosing hormones, there are so many options. It's probably the area of pharmacy that has the most options, to be honest. This is a very personalized area. People absorb things differently, people metabolize things differently, and so that calls for a lot of different options. I wanted to go through some of them and answer some questions that you may have. So the first option is oral. These are what you typically think of when you think of taking a medicine. It's swallowing a pill. These are oral micronized progesterone capsules. These are commercially available as the brand name Prometrium, and it is bioidentical. This is exactly what your body makes. What I like about oral progesterone is when you swallow it, it goes through the liver, and the metabolites that are formed are amazing. They bind with the GABA receptors, which helps to calm your mood, which helps you to sleep. I sleep like a baby when I'm on my progesterone. I do not miss it. However, when you swallow estrogen and testosterone, it's a little bit different story. First of all, testosterone's not absorbed well at all, so we just don't swallow it. Estrogen, when you swallow it, it goes through the liver and it creates some metabolites of its own. And these metabolites are not so friendly. They can cause a lot of inflammation. They can stir up some blood clotting issues, and we just don't like oral estrogen. Next, we have things that dissolve. These can dissolve in the mouth, in the cheek, under the tongue, different places. But one of them is a troche. It comes in a little thing like this, and there's not any in here, but they sort of have a consistency of a gummy bear, and you put it in between your cheek and your gum, and you let it dissolve. Then you have rapid dissolve tablets, which look like this. They're called RDTs for short. You also can put them in the mouth and just let them dissolve. It's really important not to swallow the saliva until they are dissolved completely, because then they become an oral dosage form. And like we said, we don't like oral estrogen. And there's a third option if you want to dissolve it in your mouth. This is called a tablet triturate. Just a little bitty tiny thing, and it dissolves a little bit quicker than the troches. Also, you can dissolve it in between the cheek and the gum or under the tongue. Those are your orally dissolving options. Then we have, my favorite, is a transdermal cream. It comes in a little dosing device like this, and depending on what your doctor prescribes, you may use 2 clicks or you may use 3 clicks or 4 clicks, but you just click it, and there's your 2 clicks of cream. You can apply it to your skin like this. You use the applicator to rub it in. You want to make sure it's rubbed in until it feels a little dry, because otherwise it can be transferred to children or pets or spouses, and we don't want that. Another area of skin, and rub it in. I just wouldn't touch it with my hands, but you don't want to transfer it to someone else. So that's the cream option. If you're prescribed a cream and you don't like it because it's so messy, if you're prescribed 1, 2, 3, 4 clicks of cream, that's a lot of cream to rub in. You can have your compounding pharmacist call your doctor, and they can adjust the concentration of the cream so that it's more concentrated, but you use fewer clicks. So if the 4 clicks is too much, ask them to make a more concentrated cream so that you can just do 2 clicks. And sticking with the transdermal options, we also have patches. They're this little bitty thin, they look like Band-Aids. You put them on your skin, and they're dosed either once a week or twice a week, depending on the formulation. Again, there's so many options. Those are great because the estrogen kind of leaks out of them slowly over a long period of time. And again, it's transdermal, so the estrogen goes through the skin, which is one of my favorite options. And then we have pellets. I do not actually have a pellet device, which is called a troche, but this is similar and it will demonstrate the point. But it is not quite this big. It's big, but it's not quite this big. They numb you up with lidocaine in the upper hip area, make a small incision with a scalpel, and they insert the troche into the hole, and then they take the pellet. They drop the pellet into the troche device. It goes into the subcutaneous tissue where it stays for 3 to 4 months, depending on how you metabolize hormones. It may even be longer. In my particular case, I'm a very slow metabolizer of testosterone, and my little pellet lasted me almost a year, which sounds great, but that came with some very unwanted side effects. We'll just leave it at that. The next option, yes, there are more options, is injections. And you can inject them much the same as you inject the pellet, but it's an oil form. And these last about 2 to 4 weeks, depending on the dose and the formulation, and depending on your absorption and your metabolism. Then we have vaginal estrogen. If it's compounded, it's going to come in a device similar to this. This is called a Topiclick Pearl. And you just pop the top open. You put your applicator down on the top of it like this. And you do the number of clicks that you're prescribed. It's usually 4. 1, 2, 3, 4. So it's just that small amount that you're going to insert vaginally. So you want to take it off like this. You insert it, and then you push the cream out. And if your compounded vaginal cream is a little messy and you have some leakage issues, talk to your compounding pharmacist and ask them if they can put it in a base that makes it cling to the walls so it stays where you want it to stay. And then there are vaginal tablets. This is what they look like. So I don't know if you can see, there's a little bitty tablet on the end of this device. So you insert this, and then you pop it. And the tablet stays where it's supposed to stay. It is a twice a week dose. And the cream is also usually used twice a week as well. Hey, what else? Oh, there is a commercially available product for vaginal estrogen cream as well. The patches are commercially available. The injections are commercially available. There are some creams and gels and mists that are available commercially as well. Most all of the other options that I mentioned are compounded, and just because it comes from a compounding pharmacy and it's not FDA approved does not mean it's not safe and effective. Most all compounding pharmacies use FDA approved ingredients, and they have such stringent regulations that they have to make it safe and effective. It has to be clean or they won't be able to dispense it. So what are my favorite dosage forms? Transdermal cream for my estrogen and testosterone, and oral micronized progesterone. Those are my go-tos. The reason I like estrogen and testosterone in a cream is you can adjust your dose. If you're having side effects and you think it's too high, you can go down to 1 click. Or if you start it and you start feeling good and then 3 weeks later you start having hot flashes again, you can go up to 3 clicks. So you can adjust your dose for the injections and the pellets. Once they're in, and you have to wear them out. For that reason, I prefer starting with a transdermal estrogen and testosterone and oral micronized progesterone. Later on, once you get established, once you're in menopause and you know that your levels aren't fluctuating like the roller coaster that perimenopause is, then maybe go to the pellets or the injections. I think you're going to have more successful outcomes if you start low and go slow and adjust the dose as you go. It is an area of personalized medicine. And just because this is right for me doesn't mean it's right for you. So I do think it is important for you to know your options. And if the dose is not working out for you, if it's not giving you the effects that you thought it would, or if you're having some side effects, ask for a different dosage form. It's not always the dose. Sometimes it's just changing how it's delivered. And if all of this is a little overwhelming and confusing, it's okay. That's why I'm here. And I would love to work with you and your doctor to come up with the right dose and right dosage form that is perfect just for you.